Hello. Welcome to Dr. Eze Health Tips Corner. Today we shall be discussing another interesting topic, typhoid fever. Okay, typhoid fever is a disease condition caused by a bacteria known as Salmonella typhi or Salmonella paratyphi. This infection can affect any age group, the young, the adults, and the elderly. Okay, it's a disease condition that is caused by infected or contaminated food. Uh, Especially from someone who has the infection, and then without proper disposal of feces or proper hygiene or sanitation, this person has an infected finger and then infects the food or fruits that other people eat, and then it goes. That is how the story started. Typhoid Mary, okay, a woman who was cooking in a restaurant and got the food infected, and a whole lot of community got infected with typhoid fever. What are the common symptoms? Okay, the commonest is high-grade fever. Usually we start with low-grade fever and then goes to a crescendo, very high-grade fever. They will come with chills, they will come with headache, they will come with general body weakness, muscle pain, abdominal pain, stomach pain, and then they will also come with loose motion, diarrhea, or constipation, depending on which stage that they present with. What are the signs? The signs will be elicited by the doctor. However, paramount among the signs is when there is complication like perforation of the intestine, which is the most dreaded complication of typhoid fever. There are other complications like infection, typhoid psychosis, anemia, low blood fever, and low hemoglobin. These are some of the other complications that will come following typhoid. Okay, very important is to run investigation to check for the presence of typhoid, Salmonella typhi or Salmonella paratyphi. Once they are confirmed, your doctor will prescribe antibiotics appropriately and then give other symptomatic management to treat the infection. However, if there is complication of perforation of the intestine, that may require surgical intervention to treat the source of perforation, because there will be leakage of feces that will contaminate the abdominal cavity, and that will worsen the infection of the patient. Okay, very important is early presentation. If you have fever that is lasting more than 2 days after taking your normal analgesic, like paracetamol, and the fever is not relenting, okay, self-medication is strictly not advised here. Okay, and then prevention is said to be better than cure. Since we know that this is coming from contaminated food, one of the best ways is to make sure you have good sanitation. Okay, especially toilet hygiene. After going to the toilet, wash your hand under running water with soap and water properly. Okay, and then avoid eating in public places where you are not sure of the sanitation or the hygiene of the persons that prepare the food. Okay, now you know better. When you have any symptoms suggestive of typhoid, run to your doctor early enough for adequate and proper management, investigations, and treatment. Okay, now you know better. Take care. See you next time. If you have any questions, we can meet at the comment section. Bye.